This is Dr. Michael Ryan with Missouri Vein Care answering the question, is phlebitis a dangerous condition? And the answer is, in the vast majority of circumstances, no. There are some very rare instances where phlebitis can be a dangerous condition or be associated with other conditions that really need more urgent medical attention. Most of the time, phlebitis occurs because of trauma, because you're sitting in a car for too long, and that means the blood inside one of the veins has closed off and you get inflammation around the vein. It's self-limited, which means it goes away usually on its own, and it doesn't represent a serious condition. Another common source of phlebitis is when someone has an IV in their arm or hand, wherever it might be, that gets inflamed, and that is also not a dangerous condition. As soon as you remove the IV, the phlebitis goes away. So what can represent a more serious condition is when the phlebitis is in a large vein in your leg, and that large vein is a bulging varicose vein. And when people get phlebitis in that vein, it can travel up the thigh and then go into the deep system and become what's called a deep vein thrombosis, or DVT. That is a serious medical condition that can result in acute cardiac collapse, a pulmonary embolism, and even death. That's not very common, but it can happen. The good news is when people have an episode of phlebitis, they know pretty much right away that they're having it because it's very painful and sore and red. And so that's the sign to get into the doctor, and usually what they'll do is get an ultrasound and examine what's going on there. But if you do have phlebitis and you notice that it's creeping up your leg, you probably need to go back in to see your physician to get a reevaluation, and you may need to be on blood thinners. That's the antidote for phlebitis that's moving up their leg. Finally, the other very rare circumstance of phlebitis is in people that have cancer. This is not very common, but it can develop where people have an episode of phlebitis, redness and tenderness of a vein in their arm or leg, and it then pops up a few weeks later in another location, and it just keeps popping up and resolving spontaneously. And that is related to the cancer creating a situation where the blood is sticky and it tends to form clots. So that's something that does need to be evaluated. But all in all, it's a very common problem that is not dangerous. So this is Dr. Mike Ryan answering the question, is phlebitis dangerous?